Hi everyone, welcome to the Paul Chandler Show. I'm your host, Paul Chandler. And tonight's discussion, we're going to be talking about hypertension again, however, not on the coding side, but the clinical aspect of it. And also tonight, we'll be presenting it in a new animated way. So stay tuned and we'll be right back to talk about hypertension. Hypertension affects approximately 103 million Americans. There's several different documentation requirements when we're coding hypertension. So in tonight's episode, we're going to be discussing the clinical aspects of hypertension. So that way then the coders and auditors, when you're looking through the documentation, you'll be able to select those keywords that are needed. And also if you have to query the provider, then you'll be able to construct your questions so that way you can get a quick response from that provider. So stay tuned, and now we'll be learning about hypertension in a fun animated way. Hi, and welcome to this clinical discussion on hypertension, which is also known as high blood pressure. It is a common condition in which the long-term force of the blood against the artery walls is high enough that it may eventually cause health problems such as heart disease. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher your blood pressure. You can have high blood pressure for years without any symptoms. Even without symptoms, damage to blood vessels and your heart continues and can be detected. Uncontrolled high blood pressure increases your risk of serious health problems, including heart attack and stroke. High blood pressure generally develops over many years, and it affects nearly everyone eventually. Fortunately, high blood pressure can be easily detected. And once you know you have high blood pressure, you can work with your doctor to control it. Most people with high blood pressure have no signs or symptoms, even if blood pressure readings reach dangerously high levels. A few people with high blood pressure may have headaches, shortness of breath, or nosebleeds, but these signs and symptoms aren't specific and usually don't occur until high blood pressure has reached a severe or life-threatening stage. You'll likely have your blood pressure taken as part of a routine doctor's appointment. Blood pressure generally should be taken in both arms to determine if there's a difference. It's important to use an appropriate sized cuff. Your doctor will likely recommend more frequent readings if you've already been diagnosed with high blood pressure or have other risk factors for cardiovascular disease. Children age 3 and older will usually have blood pressure measured as part of their yearly checkups. If you don't regularly see your doctor, you may be able to get a free blood pressure screening at a health resource fair or other locations in your community. You can also find machines in some stores that will measure your blood pressure for free. Public blood pressure machines, such as those found in pharmacies, may provide helpful information about your blood pressure, but they may have some limitations. The accuracy of these machines depend on several factors, such as correct cuff size and proper use of the machines. Ask your doctor for advice on using public blood pressure machines. There are two types of high blood pressure: primary or essential hypertension and secondary hypertension. Now, for regarding the primary or essential hypertension, for most adults, there is no identifiable cause of high blood pressure. This type of high blood pressure, called primary or essential hypertension, tends to develop gradually over many years. Now, regarding secondary hypertension, some people have high blood pressure caused by an underlying condition. This type of high blood pressure, called secondary hypertension, tends to appear suddenly and cause higher blood pressure than does primary hypertension. Various conditions and medications can lead to secondary hypertension, including obstructive sleep apnea, kidney problems, adrenal gland tumors, thyroid problems, certain defects you're born with, meaning congenital, in blood vessels, Certain medications, such as birth control pills, cold remedies, decongestants, over-the-counter pain relievers, and some prescription drugs, and illegal drugs such as cocaine and amphetamines. Now listen up, lads and lassies. I'm going to discuss the risk factors of hypertension. First is the age. The risk of high blood pressure increases as you age. Until about age 64, high blood pressure is more common in men. Women are more likely to develop high blood pressure after the age of 65. For the race, high blood pressure is particularly common among people of African heritage, often developing at an earlier age than it does in Caucasians. Serious complications such as the stroke, the heart attack, and the kidney failure are also more common in people of African heritage. Now, the hypertension, remember also known as the high blood pressure, does tend to run in families, so it can be part of your family history. Being overweight or obese. The more you weigh, the more blood you need to supply oxygen and nutrients to your tissues. As the volume of blood circulated through your blood vessels increases, so does the pressure on your artery valves. Not being physically active. People who are inactive tend to have higher heart rates. The higher your heart rate, the harder your heart must work with each contraction, and the stronger the force of your arteries. Lack of physical activity also increases the risk of being overweight. Using the tobacco. Not only does smoking or chewing the tobacco immediately raise your blood pressure temporarily, but the chemicals in tobacco can damage the lining of your artery valves. This can cause your arteries to narrow and increase your risk of heart disease. Secondhand smoke can also increase your heart disease risk. Now, if you're like me and you love to put a whole bunch of salt on your french fries, that's going to be a problem. Because too much salt, which is sodium, in your diet can cause your body to retain fluid, which increases the blood pressure. Too little potassium in your diet. Potassium helps balance the amount of sodium in your cells. If you don't get enough potassium in your diet or retain enough potassium, you may accumulate too much sodium in your blood. Drinking too much of the alcohol. Over time, heavy drinking can damage your heart. Having more than 1 drink per day for a woman and more than 2 drinks a day for a man may affect your blood pressure. If you drink the alcohol, do so in moderation. For healthy adults, this means up to 1 drink of a day for a woman and 2 drinks of a day for the men. 1 drink equals 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of the good old 80-proof liquor. Now comes the stress. High levels of the stress can lead to a temporary increase in blood pressure. If you try to relax by eating more, using tobacco, or drinking alcohol, you may only increase the problems with the high blood pressure. Certain chronic conditions also may increase your risk of high blood pressure, such as kidney disease, diabetes, and sleep apnea. Sometimes the pregnancy contributes to high blood pressure as well. Although the high blood pressure is more common in adults, children may be a risk too. So listen up, lads and lassies. Because for some children, high blood pressure is caused by problems with the kidneys or the heart. But for a growing number of kids, poor lifestyle habits, such as the unhealthy diet, obesity, and the lack of exercise, contribute to high blood pressure. Meaning, lads and lassies of the world, put down the electronics, put down the games, get outside, run around, and enjoy Mother Nature. Thanks, Doc. I'll take it from here. Now I'm going to talk about the complications of hypertension. Because the excessive pressure on your artery walls caused by high blood pressure can damage your blood vessels as well as organs in your body. The higher your blood pressure and the longer it is uncontrolled, the greater the damage. Uncontrolled hypertension can lead to complications which include heart attack or stroke. Because high blood pressure can cause hardening and thickening of the arteries known as atherosclerosis, which can lead to a heart attack, stroke, or other complications. Hypertension can also cause an aneurysm, because an increased blood pressure can cause your blood vessels to weaken and bulge, forming an aneurysm. If an aneurysm ruptures, it can be life-threatening. Hypertension can also cause heart failure, because to pump blood against your higher pressure in your vessels, the heart has to work harder. This causes the walls of the heart's pumping chamber to thicken, known as left ventricular hypertrophy. Eventually, the thickened muscle may have a hard time pumping enough blood to meet your body's needs, which can lead to heart failure. The weakened and narrowed blood vessels in your kidneys, and this can prevent these organs from functioning normally. Hypertension can also lead to a thickened, narrowed, or torn blood vessels in your eyes, which can result in vision loss. Hypertension can also cause metabolic syndrome. Now, this syndrome is a cluster of disorders of your body's metabolism, including increased waist circumference, high triglycerides, low high-density lipoprotein, or known as HDL cholesterol, which is the good cholesterol, high blood pressure, and high insulin levels. These conditions make you more likely to develop diabetes, heart disease, and stroke. Hypertension can also cause trouble with memory or understanding, because uncontrolled high blood pressure may also affect your ability to think, remember, and to learn. Trouble with memory or understanding concepts is more common in people with high blood pressure. And finally, hypertension can also cause dementia, because a narrowed or blocked arteries can limit blood flow to the brain, leading to a certain type of dementia, known as vascular dementia. A stroke that interrupts blood flow to the brain can also cause vascular dementia. Now, that's our discussion at the hospital today with hypertension. Back to you, Paul, at the Paul Chandler Show studio. Bye-bye now. And thank you for your time on watching that education moment on hypertension. Tonight's episode of the Paul Chandler Show is brought to you by Clear Physician Services. Again, I want to thank you for watching and have an awesome rest of your night. If you like this video and want to see more, make sure that you subscribe to our YouTube channel. It's so easy. It's right there. A little button. Just push it. Subscribe. I got all night. Nothing else to do. Just subscribe.